Okay, well hello, my name is Dr. Eric Hollander and I'm at the Spectrum Neuroscience and Treatment Institute in New York City, and I have the pleasure of interviewing Dr. Donatella Marazziti, who is from the University of Pisa in Italy. And she is an expert on a broad range of different disorders, but I'm going to be talking with you now about internet addiction, which is really a relatively unknown condition, and you've done probably the most important work in the field. So why don't you give us a little bit of a background in terms of what internet addiction is?
Internet addiction is an emerging psychiatric disorder which is largely unknown. Even the prevalence is unclear. It is estimated to be around 19–20%, especially in young population, because this is the main problem. Internet addiction is a problem affecting mainly adolescents, young adults, and it can impair persistently their development and their next life. Because it impairs mainly socialization, and so school profit and.
Well, what's the difference really between internet addiction and just use of the internet by adolescents?
Well, this is a very crucial question because we don't know exactly what is the limit. So we had to set the criteria to define this emerging disorder. But just for a comparison with the other diagnostic criteria, we say that more than 1 hour can be pathological. And also the subjective feelings, the evidence that you cannot resist. And you continue and you reiterate a sort of compulsion to stay on computer, on smartphone, and such stuff.
Now, how does it interfere with functioning, or in what way does it impact?
Interference is another important criteria for setting the distinction between normal use of technology and pathological use of technologies. It's better to say technology addiction than internet addiction, probably. So yeah, there is also a problem of definition. So interference with school work, with the social relation, with family relations, this is also important.
Now, is it an addiction, or is it a compulsion, or how would you classify it?
Every time Dr. Hollander raises a major problem. So probably it is an impulsive-compulsive disorder, but it's also an addiction as it is. As all the disorders belonging to impulsive-compulsive spectrum are. So.
And are there any particular types of individuals that are particularly vulnerable to this, or any other diagnoses where you see a high rate of internet addiction?
Preliminary data, because we are still in the field of preliminary data, suggests that vulnerability factors can be at the level of neglected childhood, abuse, trauma. So the same generic factors that can constitute a vulnerability for development of psychiatric disorder, but also access to personality disorders.
Now, does it run within families, or is it occur in families that have other kinds of addictive disorders?
We don't know at all. We need data in this sense. It's just a novel disorder. Internet was not present in the parents' problem, so it's just a problem of this last decade.
Now, it turns out that a lot of people in the autism spectrum really get stuck on the internet. Is that a vulnerable population?
Yeah, there should be. And also, we call the internet addiction can promote the so-called technological autism. So, and the problem is that autistic prone subjects are more prone to internet addiction, or the contrary, we don't know.
It does seem that a lot of times when young people go away to college and they don't have the normal structure at home, they can start to spend a lot of their time on the internet. Is that a sort of a common transition period for the development?
I do not agree, because in our experience, even young people with a normal family, with normal familial support, and can become addicted to internet.
Are there any treatments that are available for internet addiction?
You know, just we are at initial stage, and we suggest mainly behavioral treatment, so cognitive behavioral treatment.
Now, how does that work? I mean, how do you do cognitive behavior therapy with someone?
It must be very aggressive, let's say, aggressive, so family should be involved in this treatment, but we don't have yet the answering findings.
So if a parent spoke to you and said, you know, I have a child with internet addiction, what should I do to change the behavior? Or should I take away all access to the internet? Should I send them away to a boot camp? What would be the right approach for parents?
So the main advices are that the internet use should be limited. The smartphone advices should be limited, and to shift the interest of the young man or woman to other interests, especially social relationship. Go outside, meet people. But you know what happens? Sometimes, you know, even children do not socialize any longer. You know, even during birthday parties, they use the smartphone without socializing. And I read a recent paper last week showing that nothing compares how to talk even with unknown people. When you are on train or metro, you know, that's nonsense, and very simple talk with strangers are very important for brain development.
Right. It does seem like when people are doing internet addiction, they're very isolated. They're not directly relating to other people, and so it sounds like a good idea to promote other kinds of social interactions. It also sounds like it's sometimes very hard to stop bad behavior, and so one approach might be to sort of deflect it into other kinds of positive habits. What do you recommend?
You know, all group activities, sports, all groups, you know, going out, meeting people, that's the best way.
Okay. And are there any medicines that are used to treat people with internet addiction?
Well, at this stage, if there is a comorbidity with other psychiatric disorder, I would give the specific drugs for that.
So what are some of the common comorbid disorders, and then how would you treat them?
What we have seen in our experience, we see very common obsessive-compulsive disorder. We also see bipolar disorder and depression. So these disorders primarily.
So obsessive-compulsive disorder,
bipolar
disorder.
Yes.
And do you ever use other kinds of somatic treatments? Would you ever use transcranial magnetic stimulation?
No. Not yet. No.
Would you ever use ECT treatment?
I would go with ECT for when ECT is necessary for those conditions where
right, so
ECT,
they have severe bipolar disorder.
Yes.
And I see that in China they have these boot camps for individuals with internet addiction. Where
they seem very aggressive. And
right.
Some people died. I heard that.
Right.
Yeah.
So you wouldn't recommend that.
No.
Now, are there any kind of intensive residential programs that you're aware of?
Not
yet.
Knowledge.
Okay.
No.
And what else do you think that our viewers would want to know about internet addiction? What are some of the important points that you want to make?
That, I mean, new technologies are very useful, are fundamental, and we need them, we cannot live without them. But like everything, we must use in the right way. And so nothing can replace meeting people face to face, looking in the other eyes, so this is very important to remind.
Okay, well thanks very much. Again, I'm Dr. Eric Hollander at the Spectrum Neuroscience and Treatment Institute, and I've had the pleasure to interview Dr. Donatella Marazziti from the University of Pisa, on this new and emerging problem, internet addiction. Thanks.
Thank you for your
Okay.
attention.
Thank you.
So,